On behalf of the Fellowship of Animal Behaviour Clinicians, I'd like to welcome you to our second question and answer session on the theme of sound sensitivities in pets. As before, the session's open to all our members, but it's particularly aimed at people working in general veterinary practice, including vets, nurses and receptionists. Last year, shortly before the firework period, we covered the emergency management of sound sensitivities. Tonight's session will focus on the longer-term treatment of sound sensitivities, which is arguably just as important as management for sound-sensitive animals. With us again tonight are the FABC's most popular infamous double act, the two Emmas, both of whom are veterinary behaviourists. Emma Baker graduated from the Royal Veterinary College in 2005. She spent the first 5 years in mixed practice, then the following 7 at the PDSA. She obtained her MSc in Applied Animal Behaviour in 2016 and is working towards her certificated clinical animal behaviourist qualification. She now works at a small animal hospital in Leamington Spa and sees behaviour cases for the practice. Emma Brown works for the Kernow Veterinary Group in Cornwall and sees behaviour cases on referral from vets around the southwest. She's an MRCVS advanced practitioner in companion animal behaviour, a certificated clinical animal behaviourist, and an Animal Behaviour and Training Council registered veterinary behaviourist. Emma Baker will start this session this evening by giving a brief overview of the options available for the treatment of sound sensitivities in pets. However, the main aim of this session is for you to ask questions, and there'll be plenty of time for this after the presentation, although please enter any questions you have during the presentation into the chat, and then we'll come back to them afterwards. So thank you very much for attending this evening. I will now hand over to Emma Baker.
Thanks, Caroline. Good evening, everybody. I'm going to turn my video off now, so I will see you shortly. And then I'll just read from for the presentation. So thank you all for listening. This Q&A session is the follow-up to the last autumn's questionnaire Q&A session on emergency management of sound sensitivities. And now we've got firework and shooting season behind us, but are hopefully not yet into thunderstorm season. Spring is as good a time as any for addressing reactivity to noise on a longer term basis. So just to recap, the previous Q&A presentation dealt with the etiologies of sound sensitivity, what can exacerbate it, how to get an emotional and motivational diagnosis, and then how to manage this issue in the short term. And so tonight is going to be about the long-term management. But if we have a solution for bonfire night, we pop our pets a pill, why do we need to go any further with treatment? Why don't we just medicate them again next year? Well, there are a number of reasons, actually, and I think they are all really important. So firstly, even if you know a noise event is coming, the medication you are using may not work as well as it should do. So you risk having a dog who suffers through the event and remembers it next time. Secondly, there will also be plenty of events that you can't predict, and there can be the odd firework all the way from September to January, or you might be out at work when a thunderstorm occurs, or you might get caught out on a walk by a crow scarer noise. So all of these extra events will cause the fear to, potentially all of these extra events will cause the fear to generalize to other contexts and other triggers and lead to a worsening of the problem. And this can cause a downward spiral. When a noise fear generalizes from fireworks to, for instance, the slamming of car doors, it's even harder to manage the problem and prevent exposure to the triggers. So becoming sensitized and reactive to car doors again, let's say, could cause the animal to be stressed and reactive more frequently, and then that could actually cause further generalization. So all of this compromises emotional welfare and makes the problem harder to address in the long run. So the best thing to do is nip it in the bud early, and you will save yourself a lot of time and effort, and your pet a lot of stress in the long run. So how do we treat? Well, applying the principles of any behaviour consultation, the first thing to do would be to continue protecting from the triggers as best as possible. So whatever you do, don't stop the management. Anything you think you could do to prevent the animal from being exposed to a trigger that makes them react is a good thing. So for instance, make sure you've got a really good soundproof, flash-proof den. Avoid walking at times and locations that risk exposure, and consider white noise or radio playing to block sounds from outside. I would say, though, if you're going to use things like radio or white noise, you will find with some anxious dogs that they can, if they hear a noise, that they can sometimes listen out over the top of the radio, or try and listen over the top of the white noise, anticipating they might hear another one. So I think rehearsing that and playing it at odd times when you're not going to be out or you're not anticipating loud noise is a really good idea. And then obviously, again, just like with any other behaviour consultation, addressing any physical health problems, as pain and disease can directly or indirectly affect emotional health issues. I won't go over this anymore here because it has been covered in other webinars. And then behaviour modification. So desensitisation and counter-conditioning are the gold standard in behaviour modification. And with a noise fear or noise anxiety, that will obviously require a gradual introduction to various sounds at a low intensity. And then subsequently the pairing of those sounds with high-value food or a toy, etc. Sarah Heath and John Bowen designed a series of recordings for use in this. And Sound Scary is one of them. The Sound Scary MP3 file has firework recordings. Sound Social has a range of other noises that we would expect animals to cope with on a daily basis. And Sound Soothing has been designed with the arrival of new babies into a household in mind. Now, they've teamed up with the Dogs Trust and have made the recordings available and free to download from the Dogs Trust website. They have really clear instructions that come with it, not just for how to use the training program, but how to set up your sound system as well. So just briefly, there are, for instance, on the Sound Scary track, on the Sound Scary recording, there are 4 tracks, whistles and whooshes, bangs and pops. So the 2 different types of firework noise separated out into different recordings, and then a recording of all firework sounds, and then separate individual sounds. So you play the first 3 tracks at a very low level so the animal doesn't react at all, and make sure you start with the least scary. Then you can gradually increase the volume, ensuring there's still no reaction, and then replay the tracks at a lower level. But as soon as they've started, introduce the cue for a positive emotion, such as toys or food or play. And then you gradually increase the volume again, ensuring there is still no reaction, and repeat the addition of food and play. Then finally, once you're happy with all of that, then play track 4 of the recording, which is broken down into individual firework sounds. And as soon as they've heard a firework sound, you offer food, attention, or play briefly before they settle, and then the next sound comes along. So that's really briefly how the behaviour modification works. But like I say, it's very clear and very step-by-step and very owner-friendly in the instructions for the Bowen and Heath one. There is good evidence for desensitisation and counter-conditioning being effective. And one study reported that with using planned desensitisation and sound recordings, within 2 months, dogs' reactions had reduced by 60%, which is really promising. Now, if for some reason the type of sound you need to train with isn't available on the Sound Scary or the Sound Social recording, the BBC Sounds Library has a really wide range of useful noises to look for. Now, in addition to planned desensitisation and counter-conditioning, there is also what sometimes gets called ad hoc DSCC, so doing it as you go. So when a sound, etc. arises, give them a treat straight after they hear a loud noise. Now, there has been a recent questionnaire in which a large proportion of owners, 70%, reported this technique to be effective, but only 54% reported planned desensitization to sound recordings to be. So this study seemed to find that owners found it more effective to do ad hoc than planned training sessions. Now, we obviously don't know if that's because it wasn't done properly, but actually not doing it properly is also a barrier to recovery. So I think that in itself is significant. Okie doke. So once we've addressed the desensitization and counter conditioning area, then there may be areas of your behaviour plan that need to be tailored specifically to your patient's needs. So, for instance, if they bolt when they hear a loud noise, you could do some operant counter conditioning once you've had a good basis of classical counter conditioning, whereby you teach your dog to recall to the owner when they hear a sound. Or, for instance, you could do the same for retreating to a den, or you could do desensitization and counter conditioning to ear defenders, for instance, so dogs can be protected from noise while wearing them. Pheromone therapy. So there are actually some gold standard designed experimental data that revealed dog appeasing pheromone can help with sound cases. There are some other experiments too that report its success, but they either didn't have a control or they also had behaviour modification. So some studies are hard to draw absolute conclusions from. If you are using DAP diffusers or adaptil diffusers, sorry, there are a couple of things I would say. Read the leaflet really carefully because you need to switch the diffuser on and allow the oil-based vapour to rise and float around the room you're going to be using 48 hours in advance if you're using it. You need to make sure you don't plug it in under a coffee table, for instance, because the oil-based vapour needs to rise around the room. You need to leave it turned on constantly. And once it's run out, don't make the mistake of thinking because there's a small amount of oil left that it's still in use and effective. The wick will turn pale fawn once it's soaked up and dried. So perhaps all of you are very aware of that already, but I have had several people who think they can just turn it on and off like a light switch when their dog is stressed. So I think it's really important that people are aware that's not how it works. Okie doke. The other aspect of treatment that is really important is medication. So if the treatment so far hasn't been as effective as planned and the animal remains fearful or anxious, to assist with their emotional health, if they're not responding as well as you thought, we really should consider prescription medication. So there are three main types of medication, which are often known as human antidepressants. But all of these can lower fear or anxiety and reduce emotional arousal. Now, initially, they block the reuptake of neurotransmitters. So this prolongs their availability within the synaptic cleft. And with this increase of neurotransmitter, we get a feedback effect on transcription, translation, protein synthesis, and we actually get a change in the regulation of pre and post-synaptic receptors. Now, all of that takes time, and that's why these drugs take weeks to work and are not suitable for use in emergency situations. Okay. So one class of drugs that is very popular are selective serotonin reuptake inhibitors. And I've put a couple of the commonly used ones up here with dose rates for dogs and cats. And they can be used to manage anxiety. And you will often find that they're useful for dogs who display panic or bolt during a noise event. You can see some side effects. You can see them become lethargic or become anorexic. And you do need to use with caution with other serotonin enhancers. And like I said, there is a reasonably long onset of action. So we wouldn't really want to assess the success of any treatment for a good 4 to 6 weeks after they've been started. The next class of drugs are the tricyclic antidepressants, and again I've put a couple of them up here. So these actually inhibit the reuptake of serotonin and noradrenaline, but they also have varying degrees of effects on several other types of receptors around the body. So it is not selective in inhibiting the reuptake of serotonin, and you will see more side effects because more receptors are affected. But actually the serotonergic effects with these drugs are limited, and often the perceived calming down that the owners might report is due to the sedation effect rather than actually a reduction in anxiety, and I think that's worth noting. Clomipramine is actually licensed for separation anxiety, so that ought to be the one that we choose according to the veterinary cascade system. You can see a variety of side effects, including constipation, poor appetite, tachycardia and urine retention. So you would need to use with caution with patients with cardiac disease or urine retention issues. And again, the onset of action for this drug is around 4 to 6 weeks. Monoamine oxidase inhibitors. So these inhibit monoamine oxidases, which are the enzymes that break down catecholamines such as dopamine, adrenaline, noradrenaline and serotonin. So commonly they are used for their enhancement of dopamine transmission and noradrenaline release. So they're useful and are often recommended for dogs with chronic fear who are shut down, who've developed learned helplessness and are withdrawn, and may show some quite profound signs of fear, such as shaking or drooling. They're also indicated for cognitive dysfunction syndrome because they act on dopamine and promote exploratory behaviours and increase that side of things. And then side effects can include vomiting, diarrhea, restlessness, inappetence, and there are a range of drugs that they are not to be used with, including the two previous mentioned classes, plus some prescription drugs for physical health problems as well. And then finally, another drug, imepitoin or Pexion. This is licensed for the use of fear and anxiety around sounds. And actually, it can also be used for long-term. It's also got a license long-term for use in controlling seizures from idiopathic epilepsy. So it has a low affinity and binds partially to benzodiazepine receptors. The dose that one study recommends that we start it at for use as an anxiolytic is 20 mg per kg. And on that dose, improvements were detected after around about a week. But with respect to the veterinary cascade, this medication should be prescribed first because actually this is the one that has the license for this specific use as well as this species. Okay. You can, when you're using it for emergency medication around a sound event, use it at the high end of the dose range, which is 30 mg per kg. So that's also worth noting because this can be used in acute management situations as well. Okie doke. So this is just a reminder and a summary, really. 49% of owners have reported in one study that their pet displayed fearful or anxious behaviour around loud noises, but in that same study, only 15% said they would bother mentioning it to their vet. So this is actually quite a low level of reporting, and it might explain why we don't see these patients until their behaviour has started to cause a real problem for their owners, destructive behaviour during a firework event, or their fear has generalised to other noises that are no longer practical to manage. So it is really important for veterinary staff at all levels to keep having conversations about behaviour with clients and to follow up on the comments they make during these consultations. There was a study in 2013 that found during 17 routine consultations, owners mentioned 58 behaviour concerns, but only 10 of those were actually dealt with and followed up with the vet. So we mustn't let these things slip through the net, as they are so hard to deal with once they get started. So remember that emergency management is absolutely imperative, but it can only get you so far. The gold standard treatment is planned desensitisation and counter conditioning, but actually ad hoc is better than nothing at all. Adaptil may help, and there are a wide variety of prescription medications available to help manage the patient's welfare as well. Thanks very much. That's everything.